So, you have to understand, the whole basis of psychiatry from the beginning has been to disrupt normal function of a normal brain. Because there has never been any proof that the brain, any definitive proof, that the brain is the direct cause of the behavioral anomalies that are termed symptoms that are being classified as mental health disorders or psychiatric disorders. Now, obviously, before I start this video, I want to remind everybody I'm not a physician, I'm not an MD, I'm not an ND, I'm not a DO, I'm not a chiropractor. I'm not a nurse, I'm not an RN, I'm not an LPN, I'm not a nurse practitioner, I'm not a nutritionist, I'm not a dietitian. This video does not constitute medical advice. If you have a medical question, seek the advice, or if you have a medical question or a medical concern, of course, seek the advice of somebody with a medical degree and a medical license. I am not such a person. So how do brain neurons communicate? Okay, so of course, sending neurons release a neurotransmitter into a tiny gap between neurons known as a synaptic cleft, and the neurotransmitter then binds with the receptors on the second neuron. Neurons are nerve cells, of course. The neurotransmitter is said to fit into the receptor like a key into a lock. This binding action either causes the second receiving neuron to fire or inhibit its firing. An excitatory response passes the message along the neuronal pathway. An inhibitory response dampens the neuronal activity. To end the message, the chemical messenger is then transported back into the first neuron and stored for later use. The, quote, chemical imbalanced hypothesis, and I want to remind you, it's not a proven fact. In fact, there's much evidence against the chemical imbalance hypothesis. There's not very much evidence to support it. Okay, in the 1960s, researchers discovered that antipsychotics and antidepressants interfered with the messaging process. So it interfered with the messaging process, and their discoveries led to the hypothesis that mental disorders are due to chemical imbalances in the brain, which are then fixed, in quotations, or put back to normal by psychiatric drugs. For example, antidepressants were found to increase levels of the neurotransmitter serotonin in the brain, and thus researchers hypothesized that depression was due to too little serotonin. Antipsychotics were found to block dopamine. Now, you have to understand, this is like saying that if Tylenol gets rid of your headache, that your headache is caused by a lack of Tylenol. Do you understand how idiotic this is? To test these hypotheses, researchers conducted studies to determine whether people with depression had too little serotonin in the brain, or whether people with schizophrenia regularly had too much dopamine activity. Decades of research failed to provide the confirming evidence. In 2005, Kenneth Kendler, co-editor-in-chief of Psychological Medicine, summed up these research findings in this succinct way: "We have hunted for big, simple neurochemical explanations for psychiatric disorders and have found them, and have not found them." So they have hunted for big, simple neurochemical explanations for psychiatric disorders and have not found them. A Paradigm for Understanding Psychiatric Drugs, a 1996 paper from the National Institute of Mental Health, Director Stephen Hyman provided a good description of how psychiatric medications actually work. The drugs are better understood as agents that create abnormalities. So keep that in mind. They're agents that create abnormalities in brain function. So you're taking a normal brain and turning it into what in young Frankenstein would be called an abnormal brain. If you haven't seen Young Frankenstein with Gene Wilder, I highly recommend you see it. It's a great movie. Psychotropic drugs, Hyman noted, all perturb, meaning they perturb normal transmitter activity in the brain. The brain, however, has various feedback mechanisms to monitor its neurotransmitter activity, and in response, the drugs perturbation of its normal functioning, it goes through a series of compensatory adaptations. The brain is seeking to maintain its normal functioning. For instance, if a drug raises serotonin levels, the brain decreases its own serotonergic activity. If a drug blocks dopamine receptors, then the brain increases its dopaminergic energy or activity. So it balances itself and so forth. At the end of this compensatory process, Hyman wrote, the brain is now functioning in a manner that is qualitatively as well as quantitatively different from the normal state. So the drugs are causing a chemical imbalance. This is from the guy that was the head of the National Mental Health, National Institute of Mental Health. So let's read that again. Psychotropic drugs, Hyman noted, all perturb normal neurotransmitter activity. If a drug raises serotonin levels, the brain decreases its own serotonergic activity. If a drug blocks dopamine receptors, then the brain increases its dopaminergic activity, and so forth. At the end of this compensatory process, the brain is now functioning in a manner that is qualitatively and quantitatively different from a normal state. Antipsychotics, the first generation antipsychotics, block dopamine receptors and thus thwart the normal transmission of messages along dopaminergic pathways to three areas of the brain: the frontal lobes, the limbic system, and the basal ganglia. Essentially, it's a chemical lobotomy. Okay, that's what this is. This is a chemical lobotomy. In response, but more thorough. The damage is more thorough. In response to the brain increases the density of its dopamine receptors, it is now said to be super sensitive to dopamine. The second generation antipsychotics were marked as atypical antipsychotics and all broad-acting agents. In addition to blocking dopamine receptors, they may also bind with serotonergic, histaminergic, adrenergic, and muscarinic receptors. For the most part, these second-generation antipsychotics thwart the passage of messages along these various neuronal pathways, triggering an avalanche of compensatory adaptations in the brain. Because these drugs are so broad-acting, there is little understanding of all the compensatory changes they cause. Antidepressants or selective serotonin reuptake inhibitors work by blocking the normal reuptake of serotonin from the synaptic cleft, and thus this neurotransmitter stays longer in the gap than normal. As such, it is thought to increase serotonergic activity. Serotonin is a very common neurotransmitter in response to perturbation. The brain decreases its own serotonergic activity. Brain neurons begin to release less serotonin, and within a short period of time, the entire pool of serotonin in the forebrain declines. In addition, neurons decrease the density of their brain receptors for serotonin. Chronic treatment with SSRIs, which I have received, may lead to a 50% reduction in serotonin receptors in the brain. Listen to that again. Chronic treatment with SSRIs, meaning for years, may lead to a 50% reduction in serotonin receptors in the brain. At that point, the brain has become desensitized to serotonin. Stimulants, Ritalin and other stimulants prescribed for ADHD, increase dopamine levels in the brain. They do so by increasing the release of dopamine from neurons or blocking the normal reuptake of dopamine from the synaptic cleft. Cocaine increases dopamine levels in this latter manner as well. Dopamine is a major neurotransmitter in the brain, and in compensatory response to such. So if you're wondering, if you know anything about addiction, say you went to school for addiction, and you understand addiction, you're a drug and alcohol counselor or whatever. This is how addiction is formed. But with psychiatric drugs, they don't call it addiction. Okay? But that's exactly what this is. You're building up a tolerance and effectively causing chemical imbalances in the brain. Benzodiazepines affect the neurotransmitter GABA, unlike dopamine and serotonin, which transmit an excitatory message telling the postsynaptic neuron to fire. GABA inhibits neuronal activity. This is why people withdrawing from benzodiazepines have such an issue with their anxiety, and why with benzodiazepines you need more and more and more and more and more to stay normal. Mood stabilizers, like lithium, which is actually not a drug, it's a mineral, and has brain dampening effects. Its precise mechanism of action remains unknown. Anti-seizure drugs used as mood stabilizers may alter brain activity by affecting ion channels. Now, what's funny is lithium is actually a necessary trace mineral, and it actually does work. It's actually somewhat of a miracle drug in trace amounts, not in mega doses like they give you. So anti-seizure drugs act as mood stabilizers, may alter brain activity by affecting ion channels and cell membranes. These drugs may also amplify the effects of GABA, much like benzodiazepine. Atypical antipsychotics used as mood stabilizers block dopamine pathways in the brain and thus limit activity in the frontal lobes and the limbic system and the basal ganglia. So like a lobotomy, but more complete in affecting more parts of the brain. So what about brain damage caused by antipsychotics? In the past 2 decades, countless medical studies have shown that the use of neuroleptic psychiatric drugs, also known as antipsychotics, are associated with structural brain changes. Let me read that again. So it's not as easy as just stopping the drug, because the brain has been altered. As I explained earlier, you're changing the neurotransmitters and the way that the neurons receive neurotransmitters in the brain, effectively altering a normal brain. So in the past 2 decades, countless medical studies have shown that the use of neuroleptic psychiatric drugs are associated with structural, meaning changing the structure of the brain, especially when taken in high doses for a long time. Okay? These brain changes can include shrinkage of the higher level parts of the brain, meaning the frontal lobes. The shrinkage can be seen in brain scans and autopsy studies. So whereas the mental illness cannot be proven to exist, the damage caused by these psychiatric drugs absolutely is proven to exist. Keep that in mind. So they can't use a brain scan to diagnose you with a mental health issue. They can't use a blood test to diagnose you with a mental health issue. But if they do a scan of your brain, they can see the shrinkage caused by the psychiatric medications that are supposed to treat your psychiatric disorder that they can't even prove exists. And furthermore, if they do an autopsy of the corpse, they can obviously see that the brain has shrank. And these are the higher functioning parts of the brain necessary for what makes you a human being. So in response to industry defenders who claim that this shrinkage is from the mental illness, studies show neuroleptics lead to similar brain changes in animals. While the medical, and keep in mind, schizophrenia, and I'm going to be doing another video on human ethology, and again nutrition, but on human ethology, which is the study of human behavior and like animal behavior, animals have never been shown to have schizophrenia. There's not one case of schizophrenia proven in an animal. Okay, while the medical side of large libraries has this information, the public media side of the library does not. In other words, the patients and their families are not being informed about what medicine has long known, that these drugs are shrinking the parts of the brain that make you a human being. Okay? So Ron Unger, chair of Mind Freedom, Lane County affiliate, is a full-time mental health counselor who has raised concerns about the way the neuroleptic or antipsychotic psychiatric drugs have been linked to shrinkage of the brain. Okay, shrinkage of brain tissue. Neuroleptic shrink brains in monkeys. And remember, monkeys aren't schizophrenic, so it can't be blamed on the mental illness. In this study, both an older neuroleptic, Haldol, which I was on for years, and a newer atypical neuroleptic, Zyprexa, which I was on for years. And I wasn't even on these for psychosis, because I've never experienced psychosis. I was on these for depressive disorder, okay, and bipolar disorder. I was given these to make me docile, okay. I was given Haldol for oppositional defiant disorder, okay. This is not an appropriate use of these drugs. In fact, these drugs are not, I would argue these drugs are not appropriate to use ever, okay. So these drugs caused significant shrinkage in the higher level parts of the brains in monkeys, meaning the parts of the brain that are necessary for making them primates, to make them think, to make them feel. Okay, these are a few of the many mainstream medical articles indicating that using neuroleptic psychiatric drugs can lead to significant structural change. Okay, structural brain damage. So keep that in mind, structural brain damage. And these are links to the articles, by the way. So you can follow this, read this, and follow the links to the articles, the scientific articles. This medical research revealed that the neuroleptics, also known as antipsychotics, may not only shrink the brain, but cause actual cell death. So they're cytotoxic as well. Okay. More about neuroleptic damage to monkey brains. Okay, The New York Times reports an extremely important discussion with psychiatrist and neuroscientist Nancy C. Andreessen. In the conversation, Professor Andreessen speaks out about her findings that neuroleptic psychiatric drugs, as a psychiatrist and neurologist, so keep that in mind, are leading to significant brain atrophy or shrinkage. So you wonder why the IQ is dropping in the country? The frontal lobes are responsible for the IQ. How many people do you think, there's quite a few, that are on these Haldols and these Zyprexas and these other neuroleptics? There's a lot of people on these drugs. Okay, in the climate crisis controversy, there are deniers, people blah, blah, blah. It's been known. Okay, I'm going to move on here. Psychiatric drugs cause brain dysfunction. Okay, so what do the following have in common? Antidepressants, steroids, antipsychotics, opioids, electroshock, lobotomies, leucotomies, power washing, and belting for patients in the insane asylum, and including malaria to cure schizophrenia. They all impair brain functioning, and it might be the reason for their, quote, success. There are currently 10 classes of prescription medications that impair brain function, including both psychiatric and non-psychiatric drugs. A number of non-drug treatments do the same, and it's not just psychiatric drugs. Some patients receiving chemotherapy complain of brain fog and problems with memory for decades. Yeah, the thing is, with chemotherapy, you're using it to actually treat a medical condition that's proven to actually exist. Okay, so you can actually weigh the benefit to risk. With psychiatric medications, you can't weigh a benefit to risk. There's no benefit, it's all risk. For decades, this topic has been one of heated controversy with some oncologists saying the impairment arises from the patient's depression and others that the impairment arises from the chemotherapy. There are many other sources of brain dysfunction, blah, blah, blah. Some of these brain impairments are reversible, perhaps when the substance is tapered and the person's brain is restored to its pre-intervention state. On the other hand, if continued long enough, these impairments may result in permanent damage to the brain. So if you've been on psychiatric drugs for the long haul and you start experiencing psychiatric anomalies while on the drugs, and then those anomalies continue when you're off the drug, it doesn't mean that you were actually sick. It could mean that the drug had caused the psychiatric anomalies and permanently damaged the brain in such a way that you are still going to exhibit those behavioral anomalies. Psychiatric drugs are a key factor given their proliferation and the fact that they may be used to ostensibly treat the cognitive impairment that arises with depression or schizophrenia, for instance. Consider a happily married woman who becomes quite depressed after her husband of 40 years confesses that he had a one-night stand many years ago. She cannot shake blah, blah, blah. This is not important. Okay, I'm going to move on here. So one of the things they don't tell you is there is a subset of schizophrenia that is niacin respondent. Okay, it is well known that niacin deficiency manifests with several psychiatric manifestations, so keep that in mind. Niacin deficiency manifests with several, not just one, several psychiatric manifestations. Also, historically, evidence has accumulated that niacin augmentation can be used for the treatment of schizophrenia. Remember, this is why I tell you to read Dr. Abram Hoffer's books, but keep in mind, historically, evidence has accumulated that niacin augmentation can be used for the treatment of schizophrenia. However, idiopathological associations between niacin deficiency and schizophrenia, blah, blah, blah. More importantly, the subgroups is good. Okay. They propose that niacin deficiency is a contributory factor in schizophrenia development in some patients. Now remember, schizophrenia is a symptom cluster. So, some people may be experiencing schizophrenia because of niacin deficiencies. Others might be experiencing schizophrenia because they've been put on these powerful neuroleptic drugs that have damaged their brains, and now they are experiencing psychosis because of the structural changes in their brains. Others might be experiencing it because of a traumatic head injury. So you can't say that, there's any one cause, but at least in some people, niacin deficiency is a contributory factor in the development of schizophrenia. So the thing that you do not hear when you go to the psychiatrist, of course, is that there's niacin-respondent schizophrenia, because they're not going to prescribe you B vitamins, of course not. The other thing that you don't hear is that there are certain vitamins and minerals that help with schizophrenia. Okay, or other mental illnesses. That's the thing that I'm getting at. This isn't just schizophrenia. This helps with a myriad of mental illnesses, and you're not being told it. When used as an adjunctive therapy with antipsychotics, imagine how well it would work without the damaging antipsychotics. Okay, so restoring a nutritional deficit reduces oxidative stress or modulating neurological pathways. Okay. An electronic database in July, blah, 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 with outcome, yada, da, 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 pulled the effect shown that B vitamin supplementation, including vitamins B6, B8, and B12, reduced psychiatric symptoms significantly. Similar effects were observed among vitamin B RCTs recipients, which used intention to treat analysis. However, no effects of B vitamins were observed in individual domains of positive, negative, blah, blah, blah. Conclusion: there is preliminary evidence that certain vitamin and mineral supplements may reduce psychiatric symptoms in some people with schizophrenia. You're not hearing this when you go to the psychiatrist, are you? Further research is needed to examine how the benefits of supplementation relate to nutrient deficits and the impact upon underlying neurobiological pathways in order to establish optimal nutrient formulations for improving clinical outcomes in this population. Future studies should also explore the effects of combining beneficial nutrients within multi-nutrient formulas. I would suggest, just anybody, regardless of whether you have a psychiatric condition or not, probably should be taking a high-quality multivitamin, but what do I know? So another thing you're not hearing about is the use of phytonutrients as potential phytochemicals and drug targets in the management of schizophrenia. Okay, this is the introduction. This is about risk factors of schizophrenia. You can read this all on your own. I just want to get down to the part that I'm interested in. Oxidative stress, inflammation, and immune system involved in schizophrenia. Recent investigations showed that oxidative stress and neuroinflammation played a critical role in the pathogenesis of schizophrenia. Inflammation, oxidative stress, and altered expression of proteins collectively had led to schizophrenia. This is why Dr. Abraham Hoffer had the successes he had with the combination of various nutrients, particularly vitamin C and niacin, with his schizophrenic patients. You should read Dr. Abraham Hoffer's works. Mitochondrial damage in neurons results in the impairment of mitochondrial respiration and changes in morphology. It also causes a low pH in the brain, leading to psychotic symptoms and cognitive deficits. These effects in peripheral tissue work as a biomarker of the disease. Oxidative stress is evident both in early onset and chronic schizophrenia. The immune system acts by producing radical oxygen species, which means free radicals, and radical nitrogen species, which are other free radicals, promoting the release of cytokines, which are inflammatory They're inflammatory chemicals that cause neuroinflammation. By manipulation of these oxidative stress responses, different new pharmacological treatments can be identified. An increased amount of radical oxygen species and radical nitrogen species saturates ability of antioxidants such as glutathione, which neutralizes them to cause oxidative stress. Another interesting thing might be N-acetylcysteine and N-acetylcysteine and glycine. Now, glycine, I might look into that and do a video on that, but I know glycine has been used successfully to treat schizophrenia. Inflammasomes after formation, I've actually done a video on that. I think it's my adrenochrome theory of schizophrenia videos. I cover that. Moreover, there is a variable response to anti-schizophrenic treatments in patients, an increase, blah, 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 blah. Okay, the involvement of abnormal immune response in the pathogenesis of the disease is evident. Okay, so maybe we shouldn't be looking at it from a psychiatric standpoint. Maybe we should be looking at it from an immunological standpoint in some patients. As I said, schizophrenia is a cluster of symptoms. However, if you're finding an immune response and the cause, the pathogenesis of the disease, maybe it's not a psychiatric disorder. Maybe some cases of schizophrenia aren't at all psychiatric. Maybe they're immunological. Maybe these people should be seeing regular doctors that are skilled with immunology. Traditionally, it is thought that the brain is protected immunologically by the blood-brain barrier, but recent studies have demonstrated a complex interaction between brain systemic inflammation and the immune system, altering the mood, behavior. Moreover, alterations in the immune system can profoundly affect neurotransmission involved in the pathogenesis of schizophrenia. It can activate the enzyme indolamine, blah, 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 these different, okay. Cholinergic system, okay, this is about the cholinergic system is a potential target for ameliorating the symptoms of schizophrenia. Nicotinic acetylcholine receptor, blah, 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 blah. These are different targets, signaling pathways, treatment, alteration in hormonal balance for the treatment of schizophrenia. Okay. Current pharmacological and non-pharmacological treatments. I'm going to move on. That's phytochemicals or phytonutrients and their role in schizophrenia. About 80% of the total population of Asia and Africa are dependent on natural therapeutics. Mainstream antipsychotic drugs are associated with severe adverse effects. Mainstream antipsychotic drugs are associated with severe adverse effects. Therefore, several phytochemicals have been investigated for neuroprotection and antipsychotic action in cell culture and animal models of the central nervous system. The vast majority of studies have demonstrated that the antipsychotic and neuroprotective action of phytochemicals is due to their antioxidant action, as well as their ability as epigenetic adaptogens, which I got into in my previous video. So keep that in mind. If you're following the younger you diet, you're getting these benefits. As pathophysiology of schizophrenia clearly depicts oxidative burden in the brain. Or if you're following Dr. Walls's protocol, okay, so this is a phytochemical class is effective against schizophrenia. Alkaloids are present in all plant. So this is a little table here. This is all of the phytochemicals that are ginkgo biloba. These are different things that have shown effectiveness against schizophrenia. So keep that in mind. Alkaloids are present in all plant parts, blah, blah, blah. So alkaloids, you can read this on your own. I want to rush through here. Polyphenols. My baby quercetin is there. Cannabinoids, phytosterols, carotenoids, other phytonutrients. Conclusion: schizophrenia is a multifactorial disease of complex etiology and pathogenesis that necessitates, because this is what you have to understand, schizophrenia is not a disease. Keep that in mind. Schizophrenia is a mental health disorder. We've already gone through the difference between mental health disorders and diseases. So it's a series of symptoms. There are probably, well, of course, there are going to be many different causes of those symptoms. So until you find out what's actually causing the symptoms, is it a brain injury? Is it a nutrient deficiency? Is it toxicity? Okay? That's the only way until you get to what's actually causing the problem. Is it a lack of sleep? Okay? Is it too much stress that has changed the way the brain is functioning? Okay? Until you is it a lack of physical activity, which I'm going to get into when I talk about zoochosis? Okay? What is causing it? Until you find out what's causing these symptoms, you can't really successfully treat it. So natural drugs such as phytochemicals have demonstrated the therapeutic potential in management of schizophrenia through modulation of oxidative stress, neuroinflammation, immune system alterations, and downstream signaling pathways. Alkaloids, glycosides, terpenes, terpenoids, polyphenols, flavonoids, polypropanoids, steroidal lactones, and amino acids are among the major classes of phytochemicals that have shown anti-schizophrenic activity in preclinical investigations. Apomorphine, luteolin, apigenin. Now these are all powerful anti-aging substances. Okay, these are powerful epigenetic modifiers, epigenetic adaptogens that have been talked about for years by people in the gerontology community, and I know that because the majority of my friends on Facebook were from the gerontology community. Okay, so caryophyllene, cannabinoids, bicalene, Resperine are among the phytochemicals that have demonstrated anti-schizophrenic potential in human studies. Therefore, it is reasonable to propose that the phytochemicals might be promising candidates for developing new agents with protective and therapeutic benefits against schizophrenia. Moreover, additional preclinical and clinical research is required for establishing pharmacokinetic and toxicity studies of phytochemicals and their best possible combinations to minimize undesirable adverse effects. Unfortunately, in spite of abundant neuroprotective potential of the phytochemicals against schizophrenia, long-term studies of these agents against schizophrenia have not been carried out. So keep that in mind. In spite of abundant neuroprotective potential of the phytochemicals against schizophrenia, long-term studies of these agents have not been carried out. It's because they are not profitable. Furthermore, the exact dose and combinations of phytochemicals should be investigated in clinical research. This is why I encourage people to check out the Younger You protocol, the Younger You diet. This is why I encourage people to check out the Walls protocol, the Nutritarian diet, Dr. Greger's How Not to Die diet. I encourage people to check out these diets because these are diets rich in these phytonutrients. I also encourage people to check out Dr. Sandra Kaufman's work. It's very important that people know these things, but your psychiatrist is not telling you these things. And that's all for this video.